All right, what about treatments? You know, the demand for drugs is surging because you have so many people infected right now, but the supplies seem to be scarce. And then we get this word from the NIH that only one monoclonal antibody treatment appears to be effective against Omicron.
Right, and again, this is where there's two different things happening here. One is the monoclonal antibodies, which we use for infusions. It has those drugs are not working and have not worked against many of the variants. There's one monoclonal antibody that does work. It has to be infusion, difficult to take. There are the oral agents, the antivirals, which are effective but in low supply. So those we really, I mean, those are a really important drug for us to have. And we talked about this at the beginning of the show. You have to be diagnosed and treated early. It's like the Tamiflu. If anybody's had taken Tamiflu, if you have flu, you get tested, you take it right away. That's where the impact is.
I was
But there's a
watching
low supply. To your point, there's no supply.
Right. So it's like, where are we with treatment then? But you know
Yeah,
what's interesting?
exactly.
I was listening to your clinical update this week, and one of the things that you talked about was proning, and I know the update is for doctors, but I'm wondering too, if for people at home that have COVID, how they lay be different?
Yeah, it's a good question. I think if you're in need of proning, you should be in the hospital. So I don't know
Okay.
if to that point, the physiology of the lung, if you're lying on your stomach, the air may go in one direction, and if you move around, you can aerate in different ways. That's a basic philosophy. So when you're sick inside the hospital on a ventilator, we can move people to enhance their oxygen supply. I'm not sure it would help you at home, but you could try